go. Hi, I'm Elizabeth LaRue. Thank you for this opportunity to give you an overview of the research we did with the UN Trust Fund. I will be doing this presentation with my co-author, Selena Palm. Now, next slide, please. The entry point into intersectional approaches for all 10 projects included in this brief was through identifying a specific group or groups of women and girls who were made particularly vulnerable to violence because of their unique identities and circumstances. But the group or groups that were identified and the intervention that was formulated was significantly different depending on the context. Next slide, please. So we learned so much from these 10 organizations, so please allow me to name all 10 grantees. The learning we share today and in this brief is theirs. Jamaica Aid Support for Life, Leonard Cheshire Disability Zimbabwe Trust, Fundación Mundubat, Corporación Humanas, Equality, War Child Canada, Rainbow Sky Association of Thailand, Fundación Privacidade de Societat, Serbia Mental Disability Rights Initiative, and Health Age International. Next slide, please. Now we have only 15 minutes, so a brief definition of intersectionality will have to do. Intersectionality is a way of understanding that many different social categories interrelate in the lives of women and girls. Diverse identity categories such as race and gender and class, or wider circumstances such as occupation or migration and HIV status, can all intersect in compounding ways to produce new forms of vulnerability to violence against women and girls. And these categories and circumstances shape each other in complex, non-linear, and often unpredictable ways, and can create interlocking systems of oppression for women and girls. Next slide, please. Now, this conceptual framework we created in the aftermath of the inductive process of mining and synthesizing the practice-based knowledge from the 10 projects. We designed it as a tool to help increase understanding of how violence prevention projects are evolving in their various journeys with intersectionality. In practice, the entry point into intersectional approaches for most of the projects was at stage 1, at the top level, at the top of the funnel, with identifying a specific group or specific groups of women and girls that are seen as particularly vulnerable to violence due to overlapping aspects of their identities or circumstances. Now, if a project chooses to continue their journey with intersectional approaches, they can continue down the funnel to where intersectional design and implementation happens. Intersectional design moves beyond simply targeting certain groups of women by also listening to their needs and priorities and including them in program design and implementation. A project can continue even further, reaching the lowest part of the funnel for truly intersectional practice. Here you focus attention on the structures and the systems and the power relations that create and reinforce the inequalities that maintain women and girls' compounded vulnerabilities to violence. Now, while it is a funnel and the journey with intersectional approaches hopes for movement towards the bottom of the funnel, it's important to remember that organizations journeying and taking an intersectional approach may find themselves at different stages throughout the project cycle, as the process is not necessarily linear. I will now hand over to Selena, who will be sharing with you the 5 key themes that emerge from the study.
Thanks, Lisa. Hello, everyone. So, 5 key themes emerged in our review. And remember that these themes were not imposed by us as researchers, but they emerged from what partners chose to talk about in their reports and in their discussions. So first, we learned more about how projects went about applying intersectional approaches in preventing violence against women and girls. In practice, this almost always began by organisations identifying specific groups with multiple vulnerabilities in their contexts, and then seeing how these vulnerabilities intersected or compounded in unique ways in actual women's lives. This led to a range of different but specific entry points being adopted in various contexts. For example, in Thailand, Rainbow Sky Association focused its primary attention on the specific intersections between gender and sexual orientation, and how this was impacting the lives of lesbian, bisexual, and trans women. In Zimbabwe, Leonard Cheshire Disability Trust focused on the particular experiences of women and girls living with disabilities and their intersections around sexual violence. However, remaining alert to new intersections to emerge as high priority was also important, as well as resisting a homogenization of these groups. For example, FSIS in Guatemala, who you're going to hear about directly later on, worked with sex workers who experienced a range of intersecting marginalizations, as the quote on the slideshow shows. Their HIV status was a vulnerability that was initially identified for program focus, but over time, and with consultations with the group itself, migrancy status and identity documentation emerged as a higher immediate priority for many women in that group. Next slide. Second, important lessons emerged around the ongoing invisibility of certain intersecting vulnerabilities, and therefore the need to make them more visible as a first critical step. This invisibility was identified across a number of different domains, where some groups or identities that could be risk factors for violence remained invisible in data collection or official statistics, unreached within existing services, or at a wider systems level across the violence against women and girls sector. One other domain identified was the ongoing invisibility of perpetrators, typically men, with many programs focused on working with victims and survivors only, which is a real concern for prevention. For example, HelpAge in Moldova drew attention to ways in which the specific needs and challenges of older women around experiencing violence were invisibilized, even within the provision of services to prevent violence against women. They also highlighted the fifth domain of invisibility, where individuals may be reluctant to disclose aspects that make them vulnerable because of internalized stigma, as well as justified fears of external stigma. Ensuring safe visibility and voice to those groups who are often still left behind requires an intersectional approach, as the quote on the slide shows. Next slide. Third, the experience of and the importance of involving women with intersecting vulnerabilities in the design and implementation of the programs themselves. Meaningful participation emerged as a key strategy to increase the impact of civil society organizational programming, as well as assisting in the identification and engagement of different intersections and how these actually play out in women's lives. This helps to shape appropriate strategies for that specific context. One of the significant other advantages of this can also be a transformation of the underlying power dynamics that shape the marginalization of some women more than others. For example, in Guatemala, as the quote on the slide shows, building a cadre of women from the different groups to then provide training to other stakeholders, such as police and healthcare workers, both enable their experiences to be made visible and stories to be heard, but also help to contribute to reshaping harmful stereotypes still held by those other groups. Next slide, please. Fourth, lessons emerged around the value of partnering for intersectional approaches to preventing violence against women and girls. This had both advantages and challenges, but it could enable smaller organizations to work together whilst building on their individual specialist expertise with particular intersections. This offered an important way for small organizations not having to try and expand to do everything or be overlooked in favor of larger organizations with more capacity. Remember, an intersection approach does not mean an approach that does everything. Smaller organizations can sometimes have a stronger grassroots presence and have developed trust within the particular group it is seeking to represent. For example, in China, 4 organisations with diverse specialist experience on sexual orientation, HIV and AIDS, youth and media all came together under the umbrella of equality to develop joint advocacy strategies around domestic violence. This enabled them to approach policymakers together and ensure that no one was left behind. Intentional partnering strategies can also be relevant for delivering services in a holistic way so that women do not have to split themselves up, as this quote on the slide notes. Next slide, please. Finally, findings emerged around the impact of COVID-19 on projects taking intersectional approaches. One overarching insight is that COVID-19 itself is one example of a new and unanticipated intersection that compounds many pre-existing vulnerabilities and disadvantages. For example, Mental Rights Disability Initiative from Serbia, who you'll also hear from later in this session, showed how women with mental disabilities who had also been institutionalized experienced hyper-invisibilization due to the extra isolation of COVID-19 regulations, with potential reversals in important moves towards safe forms of deinstitutionalization. At the same time, the lens of intersectionality offers important promise for how COVID-19 itself can be viewed by civil society organizations. Nuanced responses to this by donors and policymakers can help organizations deepen their intersectional approaches longer term to build back better, rather than being treated as an exceptionalized and siloed issue. Organizations already working with intersectionally vulnerable groups were well placed to identify and address new risks emerging as a result of COVID-19, including that of digital violence, as the quote on the slide shows. One aspect that stood out to me personally across the whole brief was the importance of engaging with the underlying power structures that create enabling conditions for these patterns of marginalization and vulnerability. An intersectional approach should not be reduced to just targeting certain most marginalized groups to include them in existing approaches, but must also enable organizations to better analyze how and why these vulnerabilities and marginalizations can compound, and to develop collaborative strategies to respond to these interconnected root causes in transformational ways. In the light of these 5 findings, we made a number of recommendations, and I'm going to hand back over to my colleague Lisa to share these now.
Thank you, Selena. Now, the report discusses 5 key recommendations for practitioners, and I will give you a quick overview of those. Now, first, women and girls living with overlapping vulnerabilities need to be active co-producers and co-implementers of the prevention programming that's meant to assist them. Participation is central to intersectional approaches to violence prevention because those that increase risk of being marginalized are often made invisible. Second, before designing programming, conduct an analysis of which intersecting issues emerge for women and girls in your specific context. This should guide who you work with as well as project design and delivery. Third, women and girls with overlapping vulnerabilities are often invisibilized in societies that remain unaware of their specific realities and needs. This invisibilizing has to be addressed both with women and girls themselves, but also within social systems. Fourth, if you only engage with women and girls at increased risk of experiencing violence, it can imply that these women and girls, are the ones responsible for changing their marginalization and the violence they experience. That is why it's important to also engage with the individuals, groups, and systems that make certain women and girls especially vulnerable. And then fifth, collaborate with organizations that engage with different groups of women. This can lead to joint learning, maximizing of resources, and building of synergies and shared agendas. Next slide, please. Now, the report also offers 5 key recommendations for policymakers and donors. And again, I'll give you a brief overview. First, Small local community organizations are often more visible and accessible for women and girls whose identities or circumstances put them at increased risk of violence. So prioritize engaging and funding such actors too. Second, prioritize supporting collaborative work between local civil society organizations that are already engaging with diverse groups, as this can allow for the development of intersectional approaches and collective organization. Third, intersectional approaches demand comprehensive analysis and design and adaptive programming. So it's important to allow for the time and funding for such processes. Fourth, many practitioners may need support to develop contextual intersectional approaches from the grassroots up. So you need to think through how such support can be provided. And then finally, intersectional approaches draw attention to complex power relations, including in your own system and organization. So self-critically pay attention to these power relations. Next slide, please. And then the brief offers 3 specific recommendations for researchers. First, avoid focusing only on the vulnerability of women and girls. While work has been done by researchers on perpetrators, perpetration, and root causes, practitioners still point to the need for more support to make this visible in ways that are safe. Second, be intentional, collaborative, and accountable in exploring interconnections. This includes self-reflective practices to recognize your own power and blind spots. Then third, embrace the complexity of recognizing and engaging the compounded realities of women's lives. This includes having difficult conversations around the genuine tensions that still exist in violence prevention. Now, to conclude this brief overview, let me again say that it was for both of us a great privilege to do this piece of research that really centralized those who are actually doing the work. And that was such an opportunity to learn from them. Thank you so much.